Spanish, please dial the same number you dialed with a different access code, and I'll give you that access code right now. Estás escuchando este taller en inglés. Si quieres escucharlo en español, favor de marcar el número de teléfono y luego usar este código para oír en español o escuchar en español. Es 373-4178. Otra vez, 373-4178. We've found that there are people in the district that would prefer to listen in Spanish, so we've provided a separate line, and that line number is 373-4178. That's the code to use to get in. This town hall is the fifth in a series, which is designed to get information out to our community about COVID-19 and the impact that the pandemic, the stay-at-home orders, and financial stresses are impacting our personal health. This town hall is to talk directly about the strain that the pandemic is causing on our mental health and personal relationships, and the unfortunate increase in domestic violence we've seen in some of our communities. Also, that pandemic itself causes more complications to those people most in need of immediate help. But thankfully, there are great statewide organizations with many local chapters and resources that are available today to help. So we will spend time looking at mental health and domestic violence in the midst of the pandemic and the places you can access help. I know personally that I have felt more anxious and tense than I used to. And even though I'm making efforts to exercise and to pray and to go outside, that my personal interactions with family are more intense. I'm just more impatient. But I also think that I am not alone, and that the strains I'm feeling are being felt even more so by people facing severe economic hardship. These issues are real. Your brain is an organ, like your heart or your lungs. It is impacted by what you eat, how you treat your body, and your environment, just like other parts of your body. But as a society, we often think of brain health in terms of a stigmatized mental condition. A lesson that I am learning from the pandemic is that we can't keep the difficult issues in the shadows. The pandemic is exposing the divides in many areas, economically, racially, technology, and that divide is happening on our brain health too, with those now unemployed or owners of small business under more strain than other workers. And that stress on our brain health is impacting incidences of domestic violence. There's a connection here on a few layers that we will discuss this evening. So let's start off immediately. I think I just got a note. Let me see what I can see here. Well, we were going to start with Julie Snyder from the Steinbeck Institute. Are you on, Julie? Sounds like maybe Julie had problems getting here. Let me see.
I am now on, Senator.
Oh, terrific. Good. Well, I was getting a message, and it's on the same phone that I'm talking on, so that the technology eludes me sometimes. So we'll start off with Julie Snyder from the Steinbeck Institute. So welcome, Julie, to the town hall, and thank you for taking time from your busy schedule to speak with our community this evening. If you could take a moment to tell us about the Steinbeck Institute, its mission, and the work it does for brain health.
Absolutely. And first, Senator, I really want to thank you for identifying this need in your community and inviting me to join you. I'm really honored. The Steinbeck Institute is a Sacramento-based nonprofit public policy institute. We focus on inspiring leadership among elected officials and advancing cutting-edge policy on the issues of brain health. Our founder and our executive director led the successful campaign that created the Mental Health Services Act, which now provides about $2 billion a year for local treatment of substance use and other brain disorders. I thought I'd mention just a couple of our current efforts that relate very specifically to today's topic. We are in the middle of fighting to remove barriers for people trying to access timely substance use treatment, as well as to ensure that health insurers don't discriminate against Californians who have conditions affecting their brain health. We are also pushing to expand the mental health workforce in California by tapping into the very unique experience of people who have lived with substance use and mental health conditions, otherwise known as peers, in order to provide treatment to other Californians. So it's just a couple of the examples of policies that we're trying to move forward. I think today, though, my primary role is to share how the COVID pandemic is affecting virtually everyone's sense of well-being and a couple ideas for how we can take care of ourselves. We know from history that incidences of mental health and substance use conditions rise significantly both during and after things like a pandemic, a natural disaster, or a collective trauma like 9/11. In fact, in California, we are already seeing the emergence of what I would call a co-occurring epidemic, as the crisis is putting everybody under very severe emotional, social, and economic stress. A poll was released by the Kaiser Health Foundation in late April, found that 1 in 4 Californians, just over 1 in 4 Californians, said their mental health had gotten significantly worse over the preceding week. And we also know that sales figures are showing alcohol and marijuana use are increasing as more people stay at home and are isolated. If you stop and think about it, this isn't surprising. All of us, every single one of us, is feeling the impact of the pandemic, even if we don't recognize it. It's virtually impossible to escape the bad news that's coming out. Some of us are stuck at home with kids who themselves are very stressed and really need our support. Or we've caught the virus, we know someone who's caught it, or we fear catching it at work and infecting our family. Or we've lost income and are in financial distress. Or we, quote, simply miss human contact and the ability to freely leave our home without thinking about what's going on outside. Whatever the reason is, we're all feeling stressed and anxious. And this is likely to linger long after the end of the pandemic itself. For some people, it's going to create enduring mental health and substance use issues. Nearly 4 years after the 2003 SARS pandemic, for example, more than 40% of people who survived that, who got sick and survived it, continued to suffer from PTSD and depression. And just yesterday, a national foundation that's based in Oakland called the Wellbeing Trust released a new report related to COVID-19. It estimates that up to 21,000 additional Californians could die from drug overdoses and suicide, what we call deaths of despair, due to the pandemic and the economic fallout. Unless, and I really want to emphasize this could be the case unless our leaders act quickly to improve Californians' access to both mental health and addiction care. This is a vital piece of our COVID response, and it's something that we know how to do. And on an individual level, we hope people can find the courage to take advantage of care that becomes available for us or that is available. This may be in the form of friends and family who can sympathize with what's going on. It may be in the form of what we call crisis and warm lines. They're receiving more and more calls from people like us every single day. And so I wanted to share a couple of those resources that are available statewide or nationally, and also say that there are a number of local resources as well. But I wanted to make sure that everybody on the phone would have access to the ones I'm going to lay out. So they're statewide or national. The first one's called the California Peer Run Warm Line. It has both free phone and online chat support services anytime, any day. The number for that is 855-845-7415. If texting is your preferred communication method these days, you can also reach an organization called the Crisis Text Line. You'll want to text the word TALK, T-A-L-K, to 741-741. For folks who are feeling really at the end of their rope, there is also available free 24/7 the National Suicide Prevention Lifeline. And the number for that is 800-273-8255. You can also, if you have a current doctor, we encourage you to ask your doctor about teletherapy options that allow you to receive care in the safety of your home. So we strongly encourage you to reach out for support to one of these, to a friend, to family when you need it. We all need help during this pandemic at one point or another, and it's there for you. So I'm going to stop. I just want to thank everybody who's listening for everything that you're doing to take care of yourself and help each other get through this crisis. And thank you again to Senator Caballero for providing this wonderful opportunity for all of us to gather together today.
Thank you, Julie. You gave a lot of numbers, and I really appreciate these resources. Many of the people that live in the 12th Senate District live in communities that may not have a service available, or they may not know of a service available, or they're a distance from a service. And a lot of the time, that becomes a barrier to actually accessing information. So the numbers that you gave, we'll be sure to list them with this town hall notice and on my Senate webpage as well, so that people have an idea of what kinds of things are available. And it's important that you talked about not only a phone call, but also the ability to send a text, because sometimes it's a challenge for people to want to talk to somebody right away. They feel safer sending a text. Or they may be in an environment where it's difficult to have a phone conversation, but a text is easy enough to send as well. So thank you for talking about issues that are so important, and for the work that you do at the Steinbeck Institute, because the resources that have been provided for mental health through the proposition that was passed, it was Senator Steinberg's proposition, is really important. It's an important resource. It's not enough, but it does help residents all over the state of California access mental health services. So thank you for that. Next, I'd like to welcome Krista Niemczyk from the California Partnership to End Domestic Violence. Welcome, Krista, to the Town Hall, and thank you for taking the time to be here. I'd like to ask you to take a moment to tell us about the California Partnership to End Domestic Violence, its mission, and the work that it's doing right now. And if you could talk a little bit about how the pandemic is having an impact on domestic violence incidents.
Absolutely. Thank you so much, Senator, for hosting this town hall this evening and creating a space to discuss these important issues. I have the privilege of working at the California Partnership to End Domestic Violence. We are a statewide organization, and we work closely with 200 organizations all across the state of California, including within the district, who every day are providing essential services to support survivors of domestic violence and their families, and also focus on prevention to stop the violence and abuse before it occurs. What we have seen as the COVID-19 pandemic has increased in our communities and as the shelter-in-place orders have come into effect is we've seen a real toll that this is taking on survivors who are experiencing abuse in their homes. And for us, we're mindful of a few things. One is that for many people, home was not a safe place to be even before the pandemic happened. We know that many people were experiencing violence and abuse before the stay-at-home orders went into effect. And with those orders are therefore sheltering in place with a person who's harming them. And the avenues of daily release that may have been available to them, that time to themselves when they would be at work or their partner would go to work, the children would be at school, those moments of safety and reprieve have been dramatically diminished during this time. We know that for many survivors, it can be far harder to reach out for help right now. It's hard, I think, for all of us to find a moment of quiet and privacy as we're sheltering in place with our families. But for a survivor who is experiencing abuse and has their abusive partner in the home with them, reaching out to call for help is very challenging to do in those moments. But what I want to make sure everyone knows is that domestic violence programs continue to operate. They are continuing to answer calls 24 hours a day, 7 days a week, and that help is still available. Programs have taken significant steps to help make sure that they are keeping their staff safe and healthy, but also their clients safe and healthy. So I want to give a couple of phone numbers. So first of all, the National Domestic Violence Hotline is available 24 hours a day, 7 days a week by calling 1-800-799-7233. And if it's not a safe place for people to pick up the phone and speak, they can text LOVE IS to 22522 or log on to their website at thehotline.org and click their Chat Now button. And we'll make sure the Senator has that information to put up on their website and provide with the information for this town hall. But I want everyone to know that those options exist in addition to the local domestic violence programs within the district. We also have heard from programs in the district that are getting really creative about how they provide safe housing for survivors. Survivors can still come into the shelter, and we know that that may be worrying for folks who worry about, coming into a different housing situation. So they have created safety protocols to ensure everyone's health and well-being is accounted for, including using safe hotel spaces and other spaces that are available. We also have been concerned that some of what we hear is an increase in the severity of violence that folks are experiencing right now, and also that along with that violence, that victims may be reluctant to reach out for medical care. As we have all heard about the need to make sure that our hospitals are available to those experiencing the coronavirus or other medical emergencies, we've been concerned that survivors may not reach out for medical care when they need this. In particular, we've heard from one of the programs in the district about an increase in survivors reporting that they've been strangled by their partner. And we want everyone to know that medical emergencies that are domestic violence related should absolutely still reach out for health care, whether that's reaching out to your primary doctor, reaching out to urgent care or the emergency room. Making sure that survivors get their medical health care needs met, even when it's not a coronavirus case, is still really essential. And we know our hospitals are taking all of the important steps they can to protect health and safety. The other thing I just want to say is that We know that these impacts of domestic violence are going to linger long after the shelter-in-place orders are lifted, similar to what Julie was saying about additional behavioral brain health concerns. But we know that there are so many survivors who simply don't feel safe to reach out right now, or don't feel like there's an option for them of where to go and how to be safe if they were to leave their current home. And we know that as the orders are lifted and survivors are able to find a bit of breathing space, the domestic violence programs will see an increase in calls. And so at the state level, we're working hard to make sure that they have the support they need right now through this moment and long after. And if I can just close with one note of hope, one thing I'll say, well, the two things I'll say. First is that the programs are still providing just the most incredible services. The adaptability they have shown has been remarkable. So help is still very much available. But also I just want to name that this rise in domestic violence that we're seeing during this crisis is not inevitable. We know that we can prevent violence and we can build healthy relationships and healthy relationship skills. And that's why that's such a big focus of the work that we do, so that when the next time people are staying home with their loved ones, that we don't have to fear for increases in violence. So we will continue to focus hard on making sure that folks are supported through crisis and have a vision for the long term of being able to prevent this violence from occurring in our community. So again, thank you, Senator, so much for creating this platform to be able to speak to these issues.
Well, thank you for that, and I appreciate the note of hope at the end, because that's really important to know, is that there are opportunities to prevent violence by building healthy relationships, and it's a question of having people committed to that prevention work. It's not easy work. Violence is a learned behavior, and it's an issue of trying to break that habit, if you will, and learning better ways of communicating and relating to people. So thank you for ending on a positive note, and I appreciate you being here tonight. So thank you so much. It's particularly important that people see a light at the end of the tunnel, and sometimes it's leaving, and sometimes it's trying to work through what's causing the problem. So thank you so much. Next, I want to welcome an inspiration, a colleague of mine in the California State Senate, Senator Susan Rubio. Senator Rubio, thank you so much for taking the time to be here to share with the 12th Senate District your personal perspective. And I'm grateful for your openness and your bravery in discussing about domestic violence. The fact that you're joining this call as a guest speaker both really hurts my heart and inspires my soul. So I want to thank you for sharing. And I know that so many people in the district will be strengthened by your words. So I want to ask if you could talk to us about your experience and really what your focus has been since coming to the state Senate, and your commitment to have victims have a voice and a pathway for help.
First of all, thank you so much, Senator, for allowing me to be part of this really important discussion, and to all the panelists for providing such important information. So, yes, thank you. So I do want to start by sharing what the Senator mentioned. This is critically important to me on a personal level, as I am a survivor of domestic violence. So I do understand the fear and the trauma that comes from being in an abusive home. And, of course, now more than ever with COVID-19, we have to not just generally as individuals be cognizant of our mental health, but also be mindful and checking in on our neighbors, who especially in homes that we know have the potential for violence. As Krista from the Partnership to End Domestic Violence just mentioned, with these uncertain times, combined with the stay-at-home orders, we're seeing violence in the homes. They are more frequent, more severe, and more dangerous, not just here in the state, but globally. And social isolation is absolutely necessary from a health perspective, but it makes the situation more dangerous when there's violence in the home. As already mentioned, it's amplified tremendously with the stresses of the pandemic, such as being quarantined. There's high anxiety within our families. The economic pressures of unemployment, unpaid bills, all that really translates into frustration for someone that's already prone to abuse. And so, we need to definitely be mindful and aware and be the eyes and ears of those victims that can't get help themselves. And of course, victims usually are always thinking of their children involved, and if their basic needs are in jeopardy, such as putting food on the table and having shelter for their children, their physical safety definitely will not come first. And so for non-victims, like I mentioned, social distancing doesn't mean that we cannot check in, that we cannot make a phone call to our neighbors or report unusual activities or simply just ask if they're okay when we see them. Because right now, social isolation is the ideal situation for abusers. Victims are at greater risk, of course, of control, which is something that I have personal experience with, which means that they keep victims away from family and friends and co-workers. They take resources away from victims, such as money. And in this COVID-19 era that we're connecting through Facebook and social media, technology is also taken away, so that guarantees full control and isolation. So, and unfortunately, I also know through experience the trauma and the mental health issues that come from being in an abusive relationship a long period of time, and it's really difficult to overcome. So yesterday I had another webinar on domestic violence, and I heard victims refer to what was happening to them as machismo from their abusers. And I've come to the realization that we've all, as victims, we deal with domestic violence, but if we don't see physical marks on our bodies, if it's not physical, we have a really difficult time understanding what's happening to us. And so currently I'm working on a bill to define coercive control in the family code. And again, this is something that I struggle with, because we think of abuse as markings on your body, but sometimes that coercive control is even worse in terms of the trauma that it leaves behind. And so right now, I really fear for our victims that are behind closed doors, that are being controlled in so many unhealthy ways. So because of my experience, I've wanted to do research, and I wanted to visit all the websites, not only in our state, in our country, but nationally, and I wanted to come up with at least 5 recommendations for victims of domestic violence, easy things to remember and follow. And right now during COVID-19, there's so much more useful, I believe. And so I wanted to just point out some of the things that seem so basic that we don't think of. And if anyone is a victim or knows a victim, these are just simple things that we can help them accomplish. And number one, we don't even think, but, asking a family member or a trusted friend to check in on them daily is really important. Number two, I would ask, again, victims to remove any knives or potential weapons away from sight and easy access. I was in a situation where we got into a verbal altercation, and there was a knife next to him, and he grabbed the knife and put it over my head. And so I know we don't think of these things as victims, but if we can share, we need to make sure objects and potential weapons are away from easy access. We also don't think of having a safety plan in place, which means things like memorizing the number of the domestic violence hotline when you are in a stressful situation and possibly being abused. Trying to find a number to call is probably the last thing on your mind, so having that number memorized is extremely, extremely important. And also identifying the nearest police station to the home. Also with friends, developing a secret signal with a family member or friend to let them know you're in danger, whether it is, you agree that you're going to wear a red shirt just to let your neighbor know that they need to call the police for you. And lastly, and I think Krista from the partnership also mentioned this, if someone's life is in danger, they need to call 911. I've heard from victims saying to me that they don't think their call will be answered. They believe that COVID-19 is the priority right now, and as they already shared, Krista and others, there are resources out there. People are being helped, so please reach out. There's a lot of resources to help victims currently. And so I will leave it at that. I want to thank everyone that's doing a tremendous job in trying to help victims, and I'm here to support just as well. I will leave this last thought. And I know we're talking about mental health, and I wanted to bring this up because the trauma I had was, like I said, it's been long-lasting, and through my research and conversations with victims, it takes victims anywhere from 5 to 10, sometimes 20 years to get over the trauma they suffered at the hands of their abusers. So, I wanted to change the statute of limitations where victims can come forward or feel confident enough to come forward, and last year I was successful in changing the time limit that used to be 3 years to 5 years for victims to be able to get the help in between and feel confident enough that they can reach out and bring their abusers to justice. So, again, thank you for having me. Please stay safe and continue this important work.
Thank you so much, and that list is so important. I'm going to use it and post it because I think it's really very practical. And really could save lives and give people a peace of mind that there is something that they can do to take control of the situation. And you mentioned machismo, and Hernan and I had a conversation, and Hernan is going to speak next. We can continue that conversation a little bit, but he mentioned the word, and one of the things that I wanted to discuss in relation to that word is that a lot of times it is seen as a cultural thing that Latinos or different ethnic groups are very macho or they're very male oriented. And I think what's important about the discussion is that it's not necessarily that they're macho. It's that they want control. And the control goes way beyond being macho. You can be a man, and you can be a person that's got a lot of character and a lot of zest for life. But the abuse is taking absolute control and telling people who they can. It's usually women, but sometimes it's men. Who they can see, who they can talk with, what money they can spend, and that's abusive. It's a unequal relationship between two adults where one adult is discounted and then threatened by physical force in order to get their cooperation or their submission. And so I just want to say that because a lot of times I think people misunderstand and think it's just part of our culture, but in reality it's not. It's an abuse, and you see it in every culture, and you see it manifesting itself in a violence that's just not appropriate and acceptable. And I think you'd probably agree with that too.
Yes, absolutely. And I also want to encourage everyone to reach out to youngsters too. I try really hard to go out into high schools, and I start with very simple things, and I tell students, if your boyfriend is already taking your phone away, going through your text messages, telling you cannot hang out with friends, that is abuse, and we need to be very clear that having that coercive control over a person is abuse, even if we don't see the bruises. Thank you, Senator.
Thank you so much. That's really important, and that's probably our next step is to make sure we're getting into the schools and having a conversation about relationships and about dating and about really being able to stand up for yourself and recognizing when somebody's being abusive. So now I'd like to invite Mr. Hernandez, who's from the California Farm Worker Foundation. Hernan, welcome, and thank you for joining us for this town hall. While you're obviously not here as a mental health or domestic violence expert, you bring really important information about how this pandemic is specifically impacting the farm worker community, and so much of the 12th Senate District is agriculture, and so many of our residents work in the agricultural field. What is the California Farm Worker Foundation learning about how the pandemic is impacting the brain health of this essential workforce? And really how, what have you seen in regards to the stresses and the incidences of domestic violence in the farm worker community?
Yes, thank you, Senator, for having me today. Really appreciate you inviting me to participate in this telehall. One of the things that we do in the California Farm Worker Foundation is that we're very data-oriented. We rely on information that we capture on the ground. So as our organization grows and as we continue to open up in new communities where farm workers live in, we always like to capture information and get to know them and get to know exactly what their needs are. So when COVID-19 happened, in our initiatives for helping farm workers, one of the initiatives was that we were going to capture data and conduct a survey throughout the Central Valley to get an idea of how the impacts were happening for farm workers throughout the Central Valley. So we not only captured data, we conducted a couple of focus groups, and some of the key takeaways that we got from these focus groups was that as COVID-19 is having a significant impact on the psychosocial and financial impact on farm worker survey, social isolation from friends, family, and faith-based communities is increasing stress levels. Additional sources of stress include anxiety over being infected with COVID-19 combined with financial stressors that necessitate coming to work and potentially being exposed to the virus. So one of the other things was that there was literally near unanimous concern about the ability to pay for bills, including rent and utilities. So we see the economic hardships. We see an increase in the needs for mental health services throughout farm working communities. And one thing we have been doing was we started a COVID-19 Farm Worker Relief Fund. So we're trying to tackle that economic hardship with whatever funds we get from grants and donations. And the other thing that we started doing as well is trying to fight the food insecurity aspect, given that we were noticing through numbers that a lot of farm workers were in need of basic food and essential supplies. So we have been able to conduct our initiatives in the Valley, but we have seen definitely an increase in farm workers calling our office and asking for help on referring them to the organizations like we have today, so that therefore they can receive services not only for mental health but domestic violence. Before the COVID-19 happened, we were averaging about 2 to 3 people from the Central Valley farm workers calling our office and asking for help, and us trying to find ways to give them resources and connect them to appropriate organizations that can grant them that help. And now it's just every day we get at least one or two phone calls from farm workers, either asking for help, so being connected to the clinic systems or third-party organizations that are out there, or asking for help on how to go about in getting assistance because they're in a very pressing situation, a lot of times being domestic violence at the forefront. So one thing we are seeing is there is an increase. We are working with the clinic systems and third-party providers to try to fill in some of the voids. As COVID-19 struck too, we've seen a lot of clinic systems in rural areas go from conducting services in person to now telehealth and via phone as well. One thing we are noticing once we have talked to farm workers is that there's still a gap there, and whether it's a gap in technology or whether it's them just not feeling too comfortable talking over the phone, given that they are in a household where a lot of people might know exactly what they're going through. So there's been some tough aspects that we are trying to help out with. We're in the process now of conducting a campaign and being more on the ground to make sure that we connect them with appropriate resources. but it's also giving that sense of hope so that therefore they can get out of the situations in which they find themselves today.
So you've seen an increase in the number of calls for domestic violence issues. Are there resources you've been able to send the callers to?
Yes, some of the resources, whether it's connecting them to our COVID-19 relief fund or connecting them with whether it's a basic, if they need certain essential items, we can help with that. So all they have to do is call our office, 661-778-0015, and we find a way to help them out. In the past, we've had cases where we've managed to help farm workers, whether it's transportation or getting them to the appropriate locations in order to seek help. So we serve as that middle person in which helps them navigate the whole system of attaining resources for them and their families when they do decide to leave their household or when they are in search of mental health resources and connecting to some of the clinic systems or third-party organizations that work in that field.
That's really important because many times people are isolated not only because they've been asked to shelter in place or because their abuser has created a situation where they don't have either money or a vehicle, transportation, those kinds of things, but also because some of our communities are just isolated from the bigger cities, and the services are, for the most part, in the bigger cities. So your organization provides that link for farm workers to be able to get services and meet their own particular situation needs. So that's really important. I also want to thank the Farm Worker Foundation for working with me to help to distribute not only the food bank resources, but also the personal protective equipment that we've been able to raise or to collect. More like it is farm workers as essential workers were required to go to work, but we're not being provided face masks, the gloves, and the hand sanitizers necessary to keep themselves safe. And so I really appreciate the foundation coming up alongside me and helping me to distribute those items once we've collected them from a number of organizations. And appreciate that, and we'll do another. We have another one scheduled in Fireball tomorrow, so that I'm looking forward to that, and I want to thank you. So thank you so much for participating and for all the work that you do for the Farm Worker Foundation. Your group is doing amazing work, and right now, when it's so challenging, you're really stepping up. So thank you so much. Finally, I want to welcome David Bain from the National Alliance on Mental Illness. And David, I want to thank you for joining in today and for helping me to understand biases that people with brain health challenges face. And I know on our prep call, we talked a little bit about the words that we use and how important language is. And I mentioned I was doing some violence prevention work, and dealing with the Spanish-speaking community. And when we were doing that work, we were calling it mental health issues or mental illness issues, and we changed it to behavior issues or behavioral health. And you helped me to see it as just generally as a health issue. And so I really appreciate that because words do matter, and so I want to thank you for helping me to get it right. Please tell us what the pandemic is doing to people already facing brain sickness like depression, and help us to understand how those sicknesses can also impact their caregivers and that link to domestic violence. Are you there, David? Let me just check real quick, make sure David got on the line. that allows him to talk. What I'm going to do is give him a few minutes to see if he can get on the line. We have some questions that have been sent in to us, and so maybe I can go to the questions right now until we can get David Bain back on the line, because I know he's there. And Krista, maybe this is a question that you can answer. The question is have we seen an increase during this COVID pandemic in child abuse, not only just domestic violence, but also in child abuse?
That's a great question. And, I will say it's not data that I have very readily available. But one thing I'll say about the patterns of reporting for domestic violence and I believe for child abuse during this time is that we know that there are many instances where abuse is occurring but not being reported right now. And specifically within the context of child abuse, we know that often the red flags of child abuse may come to light through interactions at schools, right? Our teachers are often some of the first to notice those signs and make reports of child abuse. And obviously those interactions are happening in a much different way than they were in the past. So I worry that, abuse that's happening in this home is even more hidden right now. And similarly with domestic violence, sorry, it sounds like there's some background noise. But similarly with domestic violence, we know that there's violence occurring that survivors don't feel safe or able to reach out right now. So I think we anticipate that with both types of violence, we may see increases in reporting. And, I will say child abuse is not my area of expertise, so my apologies for being a little vague in general on that.
No, I understand completely. And frankly, as I think about the issue a little bit more, it's a great question. You would expect to see the incidence of child abuse go up along with the incidence of domestic violence. And I, frankly, have been hearing a lot of concern expressed in the community about the safety of individuals that are being forced to shelter in place with family members that are creating danger. The challenge with child abuse is that usually the reporters are teachers and medical and dental, and it's the mandated reporters that are required when they see something unusual, and the children are staying home. They're not going to those places anymore. And so my guess is that it as you said, it's another one of those underreported issues that we're probably going to find is a lot higher than we think right now, and it's really incumbent upon those of us who see things that look unusual or children that don't look like neighbors and friends and family. Although we're all sheltering in place and we don't get to see kids much, so it's pretty hard to know that this situation is happening because we're just not seeing. Unless I see kids on a walk around the neighborhood, I just don't see any kids out anymore because they're at home and they're kept inside the house, away from each other.
If I can just add, I think that what you're saying is a great reminder for all of us to check in on the people we love and see how they're doing. As Julie said when she started, we are all struggling with this situation. And, although we need to be physically distant from one another, those social connections are essential. And checking in on friends that you're worried might be experiencing abuse, friends that you're worried are really stressed and might be taking that stress out on themselves or the people around them in unhealthy ways. and checking in on your friends where you're not worried about those things, but just want to make sure, right? We know that those connections can do so much. You can be a safe place for someone who's experiencing harm to talk about what's happening. You can be a safe sort of pressure valve to let someone let off some steam so that they don't engage in violent or abusive behaviors. And you can help make sure that your friends who may be struggling but not having an incredibly hard time with this yet never reach those darker places and those deeper struggles. So, I think it's a great reminder what you were saying, Senator, of checking in on people while we're physically separate.
That's a really good. We're getting some kind of.
Maybe it's me.
Yeah, it could be. It's hard for me to tell. It resolved itself right now. So let me get to another question. Another question that's asked is, I've heard that the first responders in New York and other places that are experiencing post-traumatic stress, that they are experiencing post-traumatic stress, and read about a doctor that committed suicide. Can you tell us if health providers should be taking special caution with their mental health? And if we live with someone who is a healthcare professional, what should we do? And I think that's a really good question. Krista or Julie, you've got an idea? I think it's a great question, because I have a sister who is a nurse and is a nursing supervisor, and the whole issue of the lack of PPE, the personal protection equipment, was really distressing, because they're taught and they learn that you absolutely have to have that equipment in order to deal with a highly contagious disease, and yet it wasn't there. And so I know that created great stress and was a challenge.
Senator, this is Julie. I think you are exactly right. I mean, I listened to a paramedic talk on NPR about the fact that he has a stressful job generally, but usually he can go home, he can blow off some steam with his family, he can get a hug, he can relax, and he has time to recover. And he said, now there's no opportunity to recover. Every day is a heightened stress level. They are fearful. Oh, I'm getting a lot of feedback from someone's phone. That they're fearful for their lives, and on top of all of that, they're isolated from their families for the protection of their families because they don't want to bring home the virus. And so I think your question and your comments are right on. I'm looking through my email, and I will find it. There is I think it's a helpline specifically being set up for healthcare providers. So I will find that information and either share it verbally or send it to you so you can post it on your website. That
would be excellent. I think that would be really good. And I think Krista's comment about the social distancing doesn't mean you don't check in with family and friends and inquire about how they're doing and just have a conversation. And that's probably one of the best stress relievers, is to be able to tell someone that you're really close to how distressed you are, and be able to talk it through, because saying it out loud makes it seem a little bit easier. And in all of our cases, there are people that are essential workers in all of our families, and it seems to me, and that actually this is one of the questions, is the stress is a lot higher on the essential workers who know they have to go in and perform a job that may put them at risk, and then the risk is not just their risk; it's a risk to their family as well, and that has a stress and a worry that's totally separate from just the fact that we're all nervous about how powerful this virus is and how it seems to be passed from one person to another without knowing who it is that's contagious and who isn't. And so I think there is a higher level of stress just as a layperson, and the more that we can talk to our families and friends about that stress, I think it is good. It's important to be able to sympathize and to empathize with people that we care about, and really it's with anybody. I just find that the reason we're wearing masks is not so that we won't get it ourselves. It's so that we don't pass it to someone else. And so I wear a mask so that if in fact I am contagious but don't have any symptoms, I'm not spreading the virus. And that's what's important about the mask. And it gets lost. It is caring for other people. And the more that you care for other people, the more you can reduce your stress and the stress of others by telling them, I do this for you because this is really important. We are all in this together. So I think David Bain is here with us.
Yes.
Are you here? Oh, great. So David, please, I'm going to welcome you. David's from the National Alliance on Mental Illness. And I want to thank you for joining us today and for helping. Well, as I said before, you helped me to understand my bias in talking about brain health challenges. And so could you tell us what the pandemic is doing to people already facing brain sickness like depression, and help us to understand how those sicknesses also impact caregivers and the link to domestic violence?
Yes, thanks for having me here today. I myself live with depression, so I'm really familiar with the impacts of this. One of the things that's really important for everybody, we're finding out now, is having a set discipline, this is my day. And for individuals who all of a sudden are at home, they're stuck at home, they're not going to school, they don't have a job, whether they were sent home or they lost their job, they don't have a set discipline, a set schedule throughout their day. So we're telling people, get up on time, the same time you did before, get up, have your breakfast, make sure you're getting enough sleep, make sure you're following your treatment plan. Most individuals who are been identified as having an issue with their brain health have formed a treatment plan with a mental health professional, which is something that we heartily recommend. It's up to each individual, has their own unique treatment plan. It's not going to be the same for everybody because everybody's body physiology is different, and the intensity of their issue might be a little bit different. So get a treatment plan that's unique and stick with that. So what's happening is a lot of people are finding out that they don't have that schedule anymore, and so they're losing that. And also, I'm really advocating against using the term social distancing, as what's been mentioned several times here before, because people are losing that social aspect. And so we can still, most of us have access to cell phones. We have neighbors we can at least shout out to over the fence. We can text one another. And I've been telling folks to reach out to others, and the action of reaching out to others helps them as well, because it's helping make those connections and let them know that there's still somebody out there, that it's not just them. What's been happening with caregivers is that they're subject to some of the same brain health issues that everybody else is too. And if their loved ones are becoming increasingly agitated, that stress impacts the caregivers as well. I've talked with people who have been caregivers for 10, 20 years, and they can develop their own type of PTSD from taking care of a mentally ill loved one who's untreated, particularly untreated. And so they need to make sure that they're checking in and taking care of their brain as well, because they deserve care too. They deserve to be part of the treatment plan. A lot of our healthcare systems, our laws, are not written to take family members into account. And so it's actually almost inhumane what goes on with some families where they're trying to be part of their loved one's treatment plan and they're being ostracized by the healthcare community. So we at NAMI advocate for more inclusion for those family members. The laws for people with brain health issues, the medical laws, are much different than any other medical condition that exists out there. So it's tougher. And fortunately, we've got somebody like the Steinberg Institute who's leading the way on some of those laws that need to be changed. And we do a lot of advocacy within NAMI, along with doing our support groups, our classes, and our public presentations that we do to try to normalize the conversation around mental illness. So it's just like the same discussion with diabetes, heart disease, or any other organ of the body. It's just the brain is just an organ of the body, and it deserves the same level of care and the same level of treatment that anybody else can get.
So, David, can you talk a little bit about what depression looks like? What is it? What are the symptoms? I think sometimes people feel something, but they don't know what it is. And it would be helpful if they had words that would go along with it.
Yeah, so particularly for me, it's a matter of being chronically sad. Sometimes people will say they're depressed because something bad happened to them, and the reality is that they're just sad. And after a couple of weeks or a month, they'll maybe get over that and move on back with their life. For someone who's got depression, it's a chronic condition, and they're feeling it no matter what, even if they don't have a reason behind feeling that way. And for me in particular, it's often an absence of emotions. It's not that I'm sad. I just don't have any emotions when I'm feeling my depression, so to speak. And so I don't get happy, I don't get angry, I don't get sad, I don't get frustrated. I'm just a clean slate. I have the best poker face that a person could have. And fortunately for me, I've been married for 20 years, and my wife is very well versed with depression. She's done a lot of her own research, and we've had a lot of conversations between she and I. And there have been a few times when I've gone off my treatment plan, and after a while she'll look at me and she'll ask me, and because she can tell that all of a sudden I've just become this clean slate of emotion, or lack thereof. And so she can figure that out by observing me. And so she helps me to get back onto my treatment plan. One of the big things is that people just don't have any energy. And so unfortunately we live in a bit of a society where people think, well, you're just a lazy bum. Get off the couch and go do something. You need to try harder. You need to focus more. Well, it's very hard when the organ that is responsible for making your decisions has a health issue. And so that's the other thing, is that people with depression often will retreat into the couch and do nothing because everything seems to be overwhelming and nothing seems to be satisfactory as far as, oh, I could do this, but that's too hard, or I could do that. No, that's not going to be enjoyable. And so everything just gets to be too difficult.
Well, thank you for that description. That is really helpful, because I think what's important is understanding those symptoms, just like you would any other health issue, and then realizing that there is a treatment plan, and that everybody's a little bit different in terms of what that treatment plan would look like. But you go to a health provider that helps you to work through that. And so I appreciate that. That's I think that's important to be able to understand the difference between the depression that may be related to an episode, like losing a member of the family or losing your job. Those are all really stressful causers of depression, but you can overcome them after time, even though at the time you feel like you're never going to get past it. The more deep-seated depression is not related necessarily to those events, and is really, you said it right, it's brain health, right? and all of our brains are a little bit different, and they all of our brains require different ways to different treatment plans. I think is the best way to say it. So
yes, there's many different tools out there that are available to us, and we just need to find the tools that work for us.
And when was it that you realized that you wanted help? Was it as an adult or as a young person, or how did that come about?
I was an adult at the time. I was in my mid-20s. I had probably been living with it for a while, but I also live with epilepsy, and epilepsy was the greater issue, and that I had finally diagnosed when I was 21, but that started when I was about 13. And I was able to hide it. I didn't tell anybody about it because this was back in the 1970s, and it was different, and you didn't tell anybody about things that were different. So as long as I could hide it, no one else knew about it. And finally, when I was 21, I had a seizure in public, and then I had to be outed at that point in time.
Yeah. Well, thank you for sharing with us, because I think that the more that people understand that there are a number of brain health issues, and that there are solutions and treatment plans, and that you can manage whatever the health plan requires you to do. And I appreciate you sharing as well the conversation about your wife, because we don't live in an island. We live with other people, and having them be part of the solution is really important as well. And the more that people realize it's not a stigma, there's nothing to be ashamed about, and that we can be supportive of each other, and that if you ask for help, a lot of the times it'll be there for you. It's really important. I think that's part of the health plan, is to make sure that there are people that can support you and can recognize the imbalance when it happens, right?
Yes.
Yeah.
Yeah, family members can be a very valuable part of a treatment plan.
Absolutely. Well, thank you for sharing with us. I really appreciate it, and I really appreciate you being here, David Bain from the National Alliance on Mental Illness. I think we've gotten almost all the questions that have been sent in, or people have already mentioned in their statements. I want to this concludes our town hall for tonight, but I want to thank all of the speakers that joined us here. I really appreciate your participation and your insights and ability to tell something about yourself that was important, I think, for people to hear as we deal with this difficult pandemic. And it's scary because it is everywhere, it seems. The mental health issues are really the things that our health is really part of. Our physical health and our mental health have to go hand in hand. And so we're challenged because there is a stigma, and many times people are afraid to come forward. And so the purpose of this town hall was to let people know that there are resources, and there are people out there that really care about them and that want to be helpful. So our fight is to return California to a normal life cycle, but frankly, it doesn't just mean that we get back to work. And frankly, returning to work isn't going to change stress and the anxiety that's been caused by the pandemic. We have a long way to go, and in order to defeat it, until we get I just drew a blank on it. It's a virus, so it's a
vaccine.
A shot. Yes. And so until we get that, we are in this together, and we need to work together, and we need to make sure that people have the resources that they need in order to be able to have a healthy life and to be able to manage the issues that are happening in their family. So I want to again thank you we all need to be healthy personally and as a community, and that includes our brain health. And so it's not just you and keeping you and your family safe, but the whole community. And that's what this town hall was about, is what do we need to do to make sure, as we keep bodies safe, that we all keep our bodies healthy, that we also keep our mind healthy. And we're all connected, and all of our actions now impact each other. And basically, if you're not in a safe place, if you're a victim, we ask that you seek help. And we'll have a list of people and resources and places that are ready to stand up for you, and know that you're not alone and that your community will put its arms around you to keep you as safe as possible. And know that my office is open even though everybody is working from home. So I'll ask you to please call our office if you need to talk to someone and to find out about resources that are available in the community. So thank you all, and be well, everybody, and stay safe. Thank you so much. That ends our town hall.